There's in the book, it alludes to the fact that something that we know, that the world wars, World War I and World War II, because of the evolving nature of the demand for reconstruction, accelerated the development of your specialty.
Very much so, and there was a whole set of surgeons who made huge contribution. Sir Harold Gillis from England and some other ones, with the First and the Second World War. Dr. Kazanjian, for example, who was just a dentist initially, and he was a war surgeon, dental surgeon, and developed fantastic reconstructive procedures. And when the war was finished, he went back to plastic surgery residency and became a very famous plastic surgeon. But yes, not only that the casualties were there, but also young surgeons who did not necessarily just want to do the same thing over and over, were sent to these war zones, and they were able to use their creativity, they were able to use their imagination and try things, because some of these casualties were so badly injured that was either doing nothing or doing something new. And that was an incentive and a great way to develop new procedures. But then most of those were, again, reconstructive, but they had a major, major influence upon the development of aesthetic surgery. And that's why those of us who are fully trained, we kind of object to people who maybe are training dermatology or even in ear, nose, throat, or some other fields, let alone gynecology or whatever, and they decide overnight after maybe...
The ENT guys right. in some cities are doing breasts.
Are they doing everything?
Let's talk about breasts. Let's go to breasts, because breasts, so everybody loves breasts.
Why not?
Why don't we love them? First of all, what percentage of patients come into your office of your practice and just come in just because they want something done to their breasts?
Well, my practice is fairly general in the sense that my statistics reflect the national statistics fairly closely. I don't want to just do noses, though I could just specialize in one thing. And I think you kind of lose perspective of the entire face and body when you're just doing one operation.
And it would get boring also, let's be honest. The same thing over and over.
Even noses are exciting. I love to do special redo noses, but I love to do them all. But get back to the breast. Breasts are about the third most common procedures performed, breast augmentations. And reductions are much fewer because the need seems to be, and the request seems to be less for it. But
although the patient satisfaction is very great in breast
reductions, fantastic, because
they can't exercise, they can't jog, the clothes don't fit right. But let's talk about augmentations, because if you walk into the Aspen Club, you're going to see a spectrum of breast augmentations, from ones that I consider to be tasteful and aesthetic, and some of them you look like Daisy May in a cartoon. And talk about what the patient expects and how important it is for you to guide the patient about proportionality and the effect of proportion on the appearance of beauty.
Well, aesthetic proportions, we talked about this earlier, of course, play a major role in breast augmentation. There's another problem, though, with over-augmented breasts. Large implants, in a way, are a one-way street. Let's say you put in a large implant in somebody, granted is out of proportion in your aesthetic sense from mind and from what it would be.
And you give the same talk to patients, I'm sure. They walk in and you're going to tell them, start out with large implants, or they're going to come in and they want to be at the health club in their little leotard.
And they bring in, the Bay Watch, sort of breast, Pamela Anderson, they bring all this stuff, to our attention. And it's a real problem. Because once that soft tissue, especially when they start with very small breasts, and that's why coming for augmentation, because they have tight skin envelopes in a very small breast. Now, it's a different group, the women who had several pregnancies, they have a little droopiness, the skin envelope is a little enlarged. We can talk about them separately. And just to kind of make another comment, that in many of those, you can just do an augmentation and you also get a lift procedure just by doing the augmentation, especially with the newer technique, which is called the dual plane. And it gets a little technical. I'm not going to get into that any further. But getting back to the large breasts, women's skins are really very far expanded over what they should be naturally. And when so the proportion between what's the person's own breast tissue and what is the artificial tissue provided by the implant itself is very much in favor of what's artificial. So, therefore, this breast afterwards has no choice but to look artificial, because these are, after all, not naturally grown breasts.